Hi, everyone. Welcome to Healthy Hearts. We are glad that you could join us tonight. My name is Megan, and I will be the moderator for tonight's event. During the presentation, we encourage your participation. Please use the Q&A button at the bottom of your screen to submit any questions that you may have, and we'll be happy to answer those for you at the end of the presentation. This presentation is being recorded and will be available to view afterwards on the Iredell Health System YouTube channel in the coming days. So I'd like to now introduce you to our speaker. Mandy Brawley has been with Iredell Health System since 2004. Before becoming the inpatient diabetes educator for Iredell Memorial Hospital, she worked at the organization's Wellness and Diabetes Center. She completed her board certification to become a certified diabetes care and education specialist in January of 2021. Mandy loves her job. In fact, diabetes is a passion and a lifestyle for her. She was diagnosed with type 1 diabetes at the age of 11 and wears an insulin pump and sensor. She is personally familiar with the struggles many individuals with diabetes have. In her role, she works with nurses, patients, caseworkers, and healthcare providers to help find ways to improve blood sugar management for patients in and out of the hospital. Originally from the mountains of North Carolina, Mandy loves to visit her family that still lives there. She has 2 school-aged children and fostered and adopted a furry black dog named Violet during the initial months of COVID. She loves to feed her friends and family as it's how she shows love and provides her with a creative outlet. So without further ado, I will hand it over to Mandy.
Thank you, Megan. So welcome to this week's Heart World. We are going to talk about a little more than the heart because it's all connected. So first I'll start out with, if it's more than just the heart, how does diabetes impact it? And how do you know if you have diabetes? What is it? So most people, when they hear the word diabetes, think something along the lines of insulin. Well, insulin is a very important part of it. So diabetes is actually the lack of adequate insulin to maintain glucose, or when I use the word glucose, can also substitute the good old Southern word sugar and with energy as well. So diabetes is the lack of adequate insulin and or the inability for the body to use the glucose and insulin. So it is possible, though, to have one or both of these problems at the same time. So like I tell my patients, it's either you're not making enough insulin, or it could be that you're just not using it the way it's supposed to. Your body is not doing that. So when glucose is used with insulin, then they're used together. It can give you energy, but where there's a lack of insulin, the glucose can stay in the bloodstream. It can't be used for energy, and this is what we call hypoglycemia, or hyperglycemia, or high blood sugar. So what does it look like if you have diabetes, or if you're wondering? Well, you would probably have a high blood sugar, okay? So this looks like, to me, especially that first one, thirst. So your symptoms of high blood sugar: extreme thirst. It's usually one of the first top signs that we'll see. And it's thirst that you just cannot get rid of. You cannot drink enough water to quench your thirst. And what happens, and you get on this nice little cycle here, when you have that excess thirst and drink a lot, well, then you've got to pee, right? So you're going to have a lot of frequent urination as well. So a lot of times this interrupts sleep. You're waking up several times a night, you're thirsty, you're drinking, and then you're peeing. And a lot of times, because remember that glucose is still stuck in the blood, it's not able to be used for energy. Well, that's going to cause a lot of fatigue because you're not able to make energy the way you normally would. So blurred vision is also listed here as one of the symptoms. And blurred vision is especially when the blood sugar changes quickly or when it's extremely high. And that can be the fluid levels in the eyes can change depending on the blood sugars. So the way I think about this is, and I won't name any restaurants, but you guys know that super sweet Southern tea. Okay, so think about how sweet that tea is. If it's too sweet, we want to add some water to it, right? We want to dilute it or add some unsweet tea. So that's what your body wants to do. when it's trying to dilute the really sugar concentrated blood, it causes the thirst. So you take in all the water or whatever you're drinking, but it's just kind of flushing through. It's trying to get rid of some of that glucose that way, but it's not effective without the insulin. Okay, so what does it have to do with your heart? So keeping your heart healthy just means that you're managing your diabetes well. Because when you're protecting your heart, your blood sugar has a lot to do with that. Okay, so high blood sugar can actually cause damage to the blood vessels. It can increase triglycerides. You guys hear us talk about triglycerides and cholesterol a lot. Well, it can raise those actually, just high blood sugar alone. And it can actually make your blood pressure harder to control as well. So what can you do about it? Well, you can check your blood sugars. If you suspect you have some of these symptoms, you're going to talk to your doctor. Okay. If you're diabetic and you're not able to get your blood sugars in a healthy range, you're going to talk to a dietitian. They are excellent sources of information and can give you a lot of suggestions on how to better target that. So also, I want you to see your doctor, not just me. They want you to see them as well, but not just when you're feeling bad. So if your doctor only sees you when you're sick, they're not going to know what feeling well looks like for you. So your doctor wants you at goal. You want to be at your goal. So you want to follow up with them. If things are going well, you still want to see your doctor on a regular basis so that they can make those associations with you. And you can even make tighter goals that way. Okay. So one of the best things to do when you're going to see your doctor is to keep a record. So writing down your blood sugars, writing down your meals, even if you're having trouble with that, or if you're trying to target where your blood sugars are high, it's one of the best ways to do that. So especially because if we only have vague numbers, okay, so let's say an A1C. So an A1C is actually an 3-month average of blood sugar level. So it's a percentage we look at. And it tells us not how high or how low the blood sugars have been, but where they've been on average. So it doesn't give us a lot of information. And the specific information when you're keeping a record can actually help your doctor target what medicines and when we need to make changes in your treatment plan. So, and please take your medicines as they're prescribed. Also, though, if you are not taking them or you had a side effect, let your doctor know. Don't let them assume that you're on these medicines because they may want to change the plan for something that would work better for you. Okay, and then always making good food choices. So we're going to talk about that just a little more at the end. So high blood sugar, okay, hyperglycemia will cause the excess blood sugar or glucose to stick to the red blood cells, okay? That makes them more jagged, gives them sharp edges, and this will injure those vessel walls. That leads to plaque buildup, and the plaque is the stuff we're trying to avoid, right, with heart disease. So this makes the blood flow more difficult. So the heart has more trouble pumping it. It's got less room to work, so the pressure is higher. It's especially problematic if that means if you are developing any blood clots, okay? So if you make small blood clots on a normal basis, well, a lot of those dissolve on their own with your body. But if they do not, they can sit in the vessel and kind of grow, and that will cause something like strokes and heart attacks. So that can be a really big problem. So one of the things I tell my patients about when I work with them in the hospital is to make that assumption. So it's not just about your heart and it's not just about your diabetes, because that works together. But when you're thinking about that super duper tea we were talking about before, the super sweet stuff, let's pretend you put another teaspoon, tablespoon, maybe 2 tablespoons of sugar in that sweet tea. So it was already sweet. You're making it sweeter. And when you put those sugar granules in the tea, you can see them. They're not dissolving immediately. And I want you to think about that as kind of what goes through the vessel. okay? So it's like little bits of sand or like sandpaper scratches all the way through the vessel, and that can injure the vessel. That means it gets little cracks or crevices in it, can cause scarring, and that's the stuff the plaque likes to hang on to. So if we can avoid those high blood sugars, we can avoid injuring those vessels and causing so much of that plaque, giving it a place to hang on to. Okay, so diabetes and heart disease, well, yes, there is a link there. So what can we do to help us to help ourselves, excuse me? So can you help your family history? No, that doesn't change. But can you change high blood pressure? Well, you can certainly manage it. Okay, so taking medications if you need them, or avoiding salt in your diet, making some good healthy diet changes can make a big difference with that. So the same's true with cholesterol. You cannot always avoid high cholesterol, especially if that runs in your family, but you can take medications to help with that, and you also can change your diet to make some healthier choices. Physical inactivity. So we are all guilty of this, especially through some of these COVID quarantines. But being more physically active is helping move blood through your system. It's actually going to help a lot more with your diabetes and heart disease. So you definitely do want to talk to your doctor about that and see if getting active could be a part of the changes that you make. Obesity goes along with physical inactivity as well. And a lot of times if you're so overweight, it's really hard to get active. So a lot of those work together. And once you make small changes, you'll see that that can be very beneficial. Poor eating habits. So a lot of times we are only grabbing that fast food meal when we're out and trying to get the kids to practice or trying to get home from an appointment. A lot of times you need those little helps and tips. Okay, so one of the things I suggest for this is meal planning. So we're going to talk about that a little more at the very end, but poor eating habits can lead to more poor eating habits. So if you're making just a couple of really healthy changes with your diet, drinking more water, a lot of times that can be very beneficial. Okay, so what does that mean for me and my body? So managing blood sugar levels can decrease the risk of complications. It means a better quality of life, and you can have good blood flow to all parts of the body, right? So we want the heart pumping and not having to work so hard. But the smaller vessels can be affected by high blood sugars. A lot of times that will result in things like poor vision. So if you've ever heard of diabetic eye disease or diabetic retinopathy, that's because we have tiny vessels in our eyes. So the tiny vessels and the larger vessels can be affected. Okay, so does it mean that you can eliminate the risk for heart disease? Probably not entirely, but you can do a lot of things to promote and to decrease the risk. Okay, so does that mean you got to go on insulin, you got to prick your finger all the time? No, not necessarily. For some people, it does. That means a more intensive way to take care of your blood sugar. But if you don't need insulin, there's a lot of other ways that we can help you to control your blood sugars. And the big thing is you got to keep track of them. See what they're doing on a daily basis. A lot of times I hear patients this last question, why do I feel good when my blood sugars are high? Well, a lot of times that's because your blood sugars have been high for a very long time. Okay, it's not that your body likes it that way. Your vessels certainly do not. It still will affect your vessels, but your body has become comfortable with your blood sugars being at that level. That means that you need to change your goals slowly. That a slow change can get you back to a healthier level. So what's the point in checking them? Well, knowing what those healthy levels are and working towards them. Okay, so another risk factor, do you smoke? If you're a smoker, that's a risk factor that you can control. Now, is it hard to quit? Yes, but is it worth it? Definitely. So you can go from having a big risk of heart disease or a smaller risk just by quitting smoking. Okay. In fact, quitting smoking for just over a year or more than a year can decrease it in half. So I told you we would talk at the end about some meal planning. This is a sample meal plan. This will be available also on a PDF version next to the recording that we'll put out. Or I use something like this sometimes. There's just any kind of a weekly to-do list or a notebook that you can separate out, okay? What I find is that if we have some sort of a plan, that we will choose to do better. So the first thing I always do is I look at what I already have. Right now, I think I have broccoli and pears that I need to use. That's going to go on my menu for the next week. I want to make sure that I get those included because I don't want to waste them. So I'm going to plan out my morning meal. That may be something left over from the day before. Lunch meal, same thing. If I have a really busy day and I'm scheduling in appointments or activities with my kids or whatever it may be for you, that is something I'm going to add into my meal plan because I know I'm going to have to work around it to plan to eat better. If I don't, I know the chances of me stopping at a fast food joint or at the convenience store because I'm starving, those chances are much higher. So if you go through and do a little bit of planning, you don't have to do it perfectly, but doing a few changes a week can really make a huge difference with that. So this one even has a little grocery list on the side. So you can add in the items you need to pick up, and you've got the ones you can use, and that can help you decide what kind of things you want to fix for the week as well. So I hope you've enjoyed this and it was helpful for some of you. And I'll turn it back over to Megan. Thank you.
Thank you, Mandy. That was definitely enjoyable and very, very useful. Good information to know. I think diabetes affects so many people that I think we'd be shocked to know exactly how many people it does affect. I personally have a really good friend who has a son who was diagnosed with diabetes. And when that happened, it completely turned her world upside down. And they've adjusted really, really well to it. And he's an amazing kid and has done really well with it. And so all of these tips you shared tonight are great things for people like that to know and anybody to know. And I think it's also important too. I hear people, and I'm sure Mandy, you probably hear this all the time, say things like, I had no idea I was diabetic. And I think some of those factors you pointed out at the beginning about that constant thirst and obviously which results in a lot of constant, more frequent urination are huge warning signs that something's going on. So as you said, certainly if those are things that are part of your life, talk to your healthcare provider because we definitely want to make sure that you're getting seen and you're getting taken care of. Right. So it doesn't look like we have any questions. So we will go ahead and wrap up. Thank you again, Mandy, for that great presentation. As a reminder to everyone, we do have one more Healthy Hearts presentation left this month. Dr. Ray Jorgensen with Piedmont Healthcare will be speaking to us about how stress affects the heart. To register for that class or that presentation, please go to iredalehealth.org, our website, and go under classes and events, and you'll see that posted there. Again, all of the recordings for the previous seminars, as well as this one tonight that Mandy did so great on, will be on our Iredale Health System YouTube channel in the coming days. And as Mandy mentioned, we'll also include the planning file that she showed there on that last slide. So again, thank you to everyone, and we hope you have a wonderful night.